Hello everyone. So I'm Dr. Tushar Mehta. I'm an orthopedic surgeon and your faculty of orthopedics. So again, we're coming up with this small video. It's on a topic called as Pylon fracture. Uh, there was a question in eMedico's app in the orthopedic image-based test. That was question number 4. So it is on Pylon's fracture. So I thought I'll come up with a more appropriate video explanation for the same. So let's discuss about Pylon's fracture. I'm sure in this image onto this side and onto this side, you can very well appreciate that this is a fracture of the distal end of the tibia, and there are more than a couple of fragments. Don't worry, we will start with the basics. First of all, the history. The word tibial pylon was first used by Destot in 1911. See, you have to understand what pylon actually means. Pylon is nothing but the pestle. I'm sure you all have heard of mortar and pestle. So pylon word is the French word for pestle, which is an instrument which is used for crushing or pounding. Now, since you have understood the origin of the word tibial pylon, let me just tell you what tibial pylon means. Please try to understand, everyone. The distal end of the tibia, including the articular surface, that is what is called as tibial plafond or tibial pylon. Please try to understand. So this is the distal tibial articular surface. I'm sure all of you can very well appreciate the distal tibial articular surface. So it is along with this distal end of the tibia. So this entire thing is what is called as pylon. Now there's a very interesting point. Till what limit I can call it to be pylon? If you have to go proximal to the distal tibial articular surface, so 8 to 10 centimeter proximal to the distal tibial articular surface is basically what is an extent of the pylon. I hope I've made it clear to all of you. So not only this distal tibial articular surface, but when you add proximal 8 to 10 centimeter to it, so this entire thing is what is called as tibial pylon. Now we are talking about Pylon's fracture. So we will discuss about Pylon's fracture. Before we go on to discuss Pylon's fracture, I want all of you to understand that this is something which is called as medial malleolus. This is something which is called as lateral malleolus, and there is a posterior malleolus also. Don't worry, the relevance and importance I will tell you in due course of time. Now, what is a pylon fracture? Of course, a fracture of the distal tibia, fracture of the pylon. Pylon fracture is a fracture of tibial pylon. But what is tibial pylon? We have spoken about it. The distal tibial articular surface, including 8 to 10 centimeter proximal to it, is the tibial pylon. So if that is fractured, that is what is called as pylon fracture. Now, do you remember that I told you that, this is medial malleolus and this is lateral malleolus, and there is something on the posterior aspect of the tibia that is what is called as posterior malleolus. Why? There's a reason. Now, when I say there's a reason, what does that mean? A pylon fracture will not include a bimalleolar fracture. In fact, it will not include a trimalleolar fracture. Please try to understand. When I use the word pylon fracture, it is not meant to use a bimalleolar fracture, which is, by the way, just for your knowledge, is called a Spott's fracture. A pylon fracture excludes trimalleolar fracture, which is, by the way, what is called as Cotton's fracture. But there's a demarcation. What is the demarcation? That in a trimalleolar fracture, if the posterior malleolus is less than 1/3 of the articular surface, we will not include it. Are you able to understand my point? So distal tibial articular surface fracture, I repeat my words, distal tibial articular surface fracture is pylon's fracture minus bimalleolar fracture minus trimalleolar fracture, particularly when the size of posterior malleolus is the fractured fragment size is less than 1/3 of the articular surface. Now, for example, there is a patient, he has intact medial malleolus, he has intact lateral malleolus, there is just a posterior malleolus fracture, and where the fracture of the posterior malleolus is more than 1/3 of the articular surface, will that be classified as Pylon's fracture? One of the classical viva questions asked in post-graduation. Yes, that will be classified as Pylon's fracture. So, see, the purpose of this video is just to make you aware of the definition. This is one of the most frequently asked viva question in post-graduation. Definition of pylon fracture. And what is the definition that we usually hear from the resident? Sir, it is a fracture of the distal articular surface of the tibia. Pylon fracture is a fracture of the distal tibial pylon which is including distal tibial articular surface plus 8 to 10 centimeter proximal to that, excluding bimalleolar fracture and trimalleolar fracture, particularly when the size of the posterior malleolus is less than 1/3 of the articular area. If there is an isolated posterior malleolus fracture where it is more than 1/3 of the articular surface, that will also be put as a definition of Pylon's fracture. Anyhow, after the definition, just to give you a fair idea that after a Pylon's fracture, you can have the distal fragment into varus, you can have the distal fragment into valgus, which I'm sure all of you all can appreciate here. I'm sure by now you must have understood that mechanism is axial loading. The mechanism is axial loading. So it is a high energy impact, which is usually due to fall from height or maybe a motor vehicle accident. But one thing is for sure, that it has to be an axial loading. It has to be a high energy impact. That is the only way, because that can lead to disruption of the articular surface and injury to the soft tissue around. So it is significantly associated with high energy trauma. Now I'm sure before I go further, all of you can see this posterior fragment here, all of you can see this anterior fragment here, and all of you can see this break in the anterior as well as posterior fragment here. This image is one of the most, I find this very interesting and astonishing image when we talk about mechanism of injury. I'm sure that you can appreciate in this image A, you are seeing that there is somebody who is having an axial loading with foot and plantar flexion. Here in C, you can see somebody is having axial loading with foot and dorsiflexion, and here you can see that there is axial loading in a foot line, just flat on the ground. So if there is a axial loading with foot in plantar flexion, you will have a posterior malleolus fracture, as you can see here. If you have an axial loading with foot and dorsiflexion, you can have an anterior fragment fracture here. And if you have a foot in axial loading and foot in the plantigrade position, then you can have both the fragments. I'm sure you all can appreciate, but all will result into Pylon's fracture. Now, how does the patient present? First thing is pain, immediate pain, severe pain, swelling, extensive swelling. Since the area is more or less subcutaneous, you will see a lot of bruising. It will be tender on palpation. When you ask the person to put weight on that extremity, he said he will say he is not able to do that. And then definitely your ankle, when you will see it clinically, it will look to be some sort of an angled or crooked, some sort of a deformity will be evident. As far as clinical examination is concerned, a first-year resident, before going for anything else, if you see an ankle like this, which is shown in this image here, the first thing is that you have to rule out the distal neurovascular status. So vascular injury has to be observed, then swelling has to be observed, then whether there are some fractured blisters or not, then whether there is some soft tissue bruising or not, there is some close degloving, or whether it is going into an impending compartment or not. Important points about clinical examination. Now, if you see something like this, that there are certain blood-filled blisters, these are called fracture blisters. So they definitely mean that there is a massive skin damage, and blisters are there, which I'm sure you can see it is a blood-filled. So that means, you can have two types of blisters, clear fluid and blood-filled. So blood-filled means, of course, massive damage. Radiology plays a very important role. It is the most basic investigation. The most basic investigation is X-ray. We always ask for an AP view, lateral view, and then the Mortis view. CT scan is a must, not only to understand the exact delineation of the anatomy of the fracture, but also when you have to understand the comminution, and when you have to decide what treatment are you going to pursue. So for preoperative planning, CT scan is a must. Honestly, CT scan with 3D reconstruction is the gold standard investigation, because it not only tells you that how much is the articular involvement, what is the orientation of the fracture, whether you have any comminution or not. And as I said in the preoperative planning, I didn't want to mention it. This is not something very standard, very authentic, but still, on CT scan, when you see an anterior fragment, a posterior fragment, and a medial fragment, this is what they call as Mercedes-Benz sign. So kind of an MCQ, Mercedes-Benz sign. You guys, I'm sure you all are aware of it. So this is called as Mercedes-Benz sign that you see CT scan, because of the anterior and the posterior and the medial fragment. So you have three classical fragments. This is the anterolateral fragment. I'm sure you all know this is what is called as the caput fragment. The anterolateral, there are three classical articular component, by the way. So you have an anterolateral chip, that is the caput fragment. You have a posterolateral chip, that is called as the Volkmann fragment, and then you have the medial fragment. So these are the three classical fragments that we observe in Pylon's fracture. Rudy and Algauer is a very, 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 very important classification. It's not only important in post-graduation as a short note, but sometimes asked in X-ray. Like, I personally will share my experience in one of the spotter rounds. I was given an X-ray of the Pylon's fracture. I was asked to identify, which I did. I was asked the definition of tibial pylon. I told them. Then I was asked what all you include in Pylon's fracture. I told them. Then they said, what all you exclude in Pylon's fracture. I told them. Then they said, okay, tell me about the Rudy Algauer classification. So you have type 1, type 2, type 3. I'll tell you in a very simple way. Type 1 is an articular fracture. Just listen to me first, then I'll show you the images. Type 1 is an articular fracture without combination, without displacement. Type 2 is an articular fracture with displacement, without combination. Type 3 is articular fracture with displacement, with combination. I'll give you an example. Type 1. Do you see an articular fracture? Yes. Do you see that fracture line is extending into the distibial articular surface? Yes. But do you see any sort of articular displacement? No, it is more or less intact. It is more or less intact. It is more or less intact. And forget about combination. There's nothing like that. Now type 2. You have articular fracture with displacement, without combination. Extensive combination. So is there an articular fracture? Yes. Is there some sort of displacement in the distal tibial articular surface? If there is some sort of displacement in the distal tibial articular surface, yes, I can see a little step off. But can I see an extensive combination? No, I cannot see an extensive combination. All I can see is a small step off. I can see an articular fracture with small step off, with small displacement. Type 3, can I see an articular fracture? Yes. With a lot of displacement? Yes. With a lot of combination? Yes. I'm sure you can count the fragments here. I'm sure you can count the fragments here and tell me that this is articular fracture without displacement, without combination. Articular fracture with displacement, without combination. Articular fracture with displacement, with combination. Rudy and Algauer classification. Will be asked, should be asked. As a short note, you should be able to identify on an X-ray as well. So you see an articular fracture, you see a cleavage kind of a fracture, but you don't see much of a displacement, much of a combination. You see articular fracture, you see entering into the distal tibial articular surface, you see slight amount of displacement and step off, but you don't see much of a combination. You see articular fracture, you see a lot of displacement, you see a lot of combination, which I'm sure you all are able to identify here. So this is Rudy and Algauer type 1, this is Rudy and Algauer type 2, this is Rudy and Algauer type 3. So my dear friends, in this video, the purpose was first to understand what is tibial pylon, how do you define it anatomically, then what is a tibial pylon fracture, what all is excluding in that, bimalleolar, trimalleolar, particularly if the posterior malleolus is less than 1/3 of the articular surface. Even if there's a posterior malleolar fragment more than 1/3 of the articular surface, it will be counted as tibial pylon fracture. Clinical presentation, what all things a resident should be careful about, what is the role of X-ray, what is the role of CT scan, what is Mercedes-Benz sign, what is Rudy Algauer classification. Alright, with this we come towards the end of this small video about Pylon's fracture. Hope this helps you in your preparation. All the best. God bless.